If you or a family member have been recently diagnosed with type 2 diabetes, or if you're just trying to learn a little more about what it is and why you need to care about it, then this video is for you. Keep watching because we're going to go over what diabetes is, how you get it, and what are the problems that can happen if you don't treat it and take it serious. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think this would be something that's helpful to you, make sure you subscribe, hit that notification button, and follow along with us. Well, this is the second video in our series on diabetes. In our last video, we discussed the best ways to recognize some of the symptoms of diabetes and when to get tested for it. Today, though, we're going to dive deeper into what diabetes is and help you understand some of the challenges that can come if you don't take this disease seriously and get it under control. We're going to focus mostly on what we call type 2 diabetes, as this is still the most common type of diabetes and one that can affect all of us if we're not careful. So first of all, let's talk a little more about what is adult onset or type 2 diabetes. This is the most common type of diabetes that we see. In fact, there are over 34 million people in the United States and over 460 million people in the world that are estimated to have it. Type 2 diabetes is also referred to frequently as adult onset diabetes. This is a condition that usually comes on slowly over time, and because of that, a lot of time we don't have any noticeable symptoms. In fact, it's so gradual in many that some of the first presenting symptoms can be the bad complications that we're going to go over today. Now, the problem that happens in type 2 diabetes is that your body becomes resistant to insulin. Insulin is a hormone that's produced by your pancreas that helps bring glucose from the blood into the different cells in the body to use it as fuel. In a normal body, you eat a carbohydrate. Your body digests it and turns it into glucose, which is then absorbed into the bloodstream. Now, your body then senses that blood sugars elevate and releases insulin to bring that down. That same process is happening in diabetes. However, your body's become resistant to the effects of insulin. You're still producing it, but it just doesn't work as well. Now, the reason behind all of this is pretty complex, and frankly, we haven't gotten to the bottom of all the reasons of why this happens. There are several factors, though, that can play a role in developing this insulin resistance. We see that genetics, age, and ethnicity play a role, but more importantly, things such as excess body weight, too much belly fat, lack of exercise, smoking, and even not getting enough sleep can play a role. On top of that, we see that the longer and higher your insulin levels are, it starts to affect your body over time. Now, the more and more your cells are exposed to high levels of insulin, the more they get tired of listening to it. The way that I like to explain it, that seems to make sense to most of us, is that I compare it to that old stereotypical grandpa who's hard of hearing and wears hearing aids. Now, this grandpa, he loves to sit on his couch watching his favorite sporting event. He has a sweet wife, though, who just loves to talk to him. Now, especially while he's trying to watch that game. So, picture the grandpa sitting on the couch, wanting to watch his game, with a sweet wife sitting next to him who just wants to talk. Now, of course, being the rude guy that he is, the more she talks to him, what is he going to do? Well, he's going to turn down those hearing aids so he can concentrate on his game. Well, the more he turns down those hearing aids, the louder she tries to talk. You can see the cycle this puts them in. So, in this analogy, your body's like the grandpa with the hearing aids, and the grandma is insulin. The more and louder she talks, the more he turns down those hearing aids. Now, I need to stop right now and give a disclaimer. I in no way condone this behavior. Grandpa really needs to listen to his wife, and turning down those hearing aids is not right. Okay, so getting back to the analogy. So the more that your body's producing insulin, over time, your body stops listening to it and becomes more and more resistant to it. So when you combine all these factors, the high levels of insulin, the inflammatory processes which happen with excessive belly fat, genetics, etc., you create an atmosphere where your body just can't handle the sugar load that your body's under. The longer your pancreas works as well to pump out higher levels of insulin, the more and more the cells that produce the insulin start to burn out and don't produce as much. All this combines to create the disease we call diabetes. Now, it's certainly a lot more complex than I'm explaining. However, I think this gives us a general idea on what is happening, and understanding this will really help us in the future as we try to make changes to our life that will help us control and beat this disease. A lot of the focus that we have when we work on controlling this will center on avoiding putting things into our body that raise our sugars and increase the amount of insulin our body needs. Now, treatments are also going to center on decreasing the insulin resistance and helping our body have an adequate supply of insulin to keep our sugars where they need to be. Okay, so that's a brief explanation of what diabetes is. It's vital that you understand that, so as we treat it, you'll have a better grasp on what we are doing and why we do it. Now, the final part of this video centers on why it's so important that you take this disease serious. What are the problems that can happen when you don't control your diabetes well? Well, the answer lies in the damage that elevated blood sugars do to the blood vessels as well as to the nerves. High levels of sugar over time cause damage to the lining of the blood vessels, especially the smaller they are. Now, over time, inflammation and hardening occur in these areas, causing the vessels to get weak or blocked. This same effect happens to nerves, where the elevated levels of sugar interfere with the nerve's ability to send signals. So you combine this with poor blood flow and damaged blood vessels, and you have nerves that are starved of the oxygen and nutrients needed to work properly. So the long-term impact of this is the reason really that we care about controlling diabetes, and is also the reason that you need to be worried about staying on top of it. We'll start from the top of the body down, describing how it impacts the various organs. Because it damages small blood vessels, we start to see changes in the arteries of the brain. This can lead over time to issues like dementia, but can also cause immediate events by putting you at risk for a stroke. It can impact the small vessels in your eyes, putting you at risk for cataracts, glaucoma, and can cause a condition called diabetic retinopathy, where the blood vessels in your eyes can rupture, leading to vision loss and possible blindness. In fact, diabetes is one of the leading cause of blindness in the United States. Moving down, that same damage to blood vessels starts to impact your heart. It increases your cholesterol and blood pressure, causing plaque formation, plugging of the arteries, and putting you at risk for a heart attack. So moving to your stomach, it can damage the nerves that control your ability to digest, causing something called gastroparesis, which is a type of paralysis to the stomach. This slows your digestion, causing, among other things, a lot of nausea and vomiting. Now it slowly starts to cause damage to the filters in your kidneys, decreasing the ability of them to function properly. Diabetes is a leading cause of kidney failure, requiring people to go on dialysis. It also affects the circulation and nerves of the extremities, especially in your feet, leading to something called diabetic neuropathy. You can get severe burning pain in your feet, as well as decreased sensation. Now, this nerve damage, combined with poor circulation, puts you at risk for injury, severe infections, and ultimately developing gangrene in the foot, leading to amputations. So have I scared you yet? Well, hopefully I have a little bit. Diabetes is not something that you want to ignore. I have patients tell me all the time, well, doc, you have to die of something. Well, I promise you, you don't want to die from the complications of diabetes. Now, the good news from all this bad news is that if you take your diabetes serious, if you make a significant commitment to changing your life and treating this as a serious condition that it is, and you watch it closely with your doctor, you have a great chance of avoiding all these issues and living a long, healthy life. Well, so that's what diabetes is and why you want to treat it. We're just getting started with diving into diabetes. In upcoming videos, we're going to be talking about things that you can do to help control this without having to always rely on medication. We'll go over the types of things that you should be checking with your doctor to make sure you don't have complications, as well as some of the more common and helpful medications if that becomes necessary. Now, so you don't miss out on these, make sure you hit that subscribe and notification buttons right now. When I get them done, I'll put the links here off to the side so you can learn more about beating this disease. Well, that's all we have today. So thanks for watching, and we'll see you on the next video.